Hi to all. My name is SIDDHAR. I'm Artificial Intelligence Avatar of SIDDHAR Ear Foundation. SIDDHAR Ear Foundation is headquartered in Vadavoli, Coimbatore, Tamil Nadu, a beautiful place on the foothills of Western Ghats. Their branches in Chennai, Ashok Nagar, Salem opposite to railway station, Trichy, Chatharam bus stand, Madurai, Kalavazal, Thirunelveli near Raila station. We offer unique and specialized treatment through the traditional system of SIDDHA medicine to regain the hearing capacity of deaf person by way of hereditary traditional SIDDHA medicine. The medicine we use is prepared through the traditional way of preparation with the unique herbs and oils only known to our family. On instilling the medicine, the hearing impaired and deaf people can hear in the normal manner by way of 6 to 12 months of treatment. People with absence of eardrums can also be treated and their hearing sense will be perfect after treatment course. The medicine used does not carry any side effects. Our treatment is a simple solution for ear problems, hearing loss, tinnitus, pus discharge. We will give treatment for all type of hearing problems like conductive hearing loss, sensory neural hearing loss, mixed hearing loss, profound hearing loss, without surgery, without hearing aid, without cochlear implantation. They also don't have to use the following in the future: sign languages, lip reading, conductive hearing loss. Conductive hearing loss is the result of sounds not being able to pass freely to the inner ear. This usually results from a blockage in the outer or middle ear, such as ear infection, ruptured in eardrum, swelling in eardrum. Due to swelling of eardrum, 3 tiny bones, the malleus, incus, and stapes, in auditory ossicles, middle ear, may dislocate, not moving freely. Sensory neural hearing loss. This type of hearing loss is sometimes referred to as sensory, cochlear, neural or inner ear hearing loss. Sensory neural hearing loss is the result of damage to the hair cells within the cochlear or weakness the auditory hearing nerve, or both. Sometimes, the hearing loss is caused by damage to the nerve that carries the signals to the brain. Sensory neural hearing loss not only changes our ability to hear quiet sounds, but it also reduces the quality of the sound that is heard, meaning that individuals with this type of hearing loss will often struggle to understand speech once the cochlea hair cells become damaged. Sensory neural deafness that is present at birth, congenital, is most often due to genetic syndromes, certain infections before birth, lack of oxygen during birth, genetic causes, low birth weight or prematurity, infections that the mother passes to her baby in the womb. SNHL may develop in children or adults later in life, acquired as a result of age-related hearing loss, disease of the blood vessels, immune disease, infections, injury, loud noises or loud sounds that last for a long time, Meniere disease, tumor, use of certain medicines. This type of hearing loss can be further broken down into sensory hearing loss, in which the hair cells inside the cochlea are affected, central hearing loss, in which the central auditory processing pathway is affected. Mixed hearing loss refers to a combination of conductive and sensory neural hearing loss. This means that there may be damage in the outer or middle ear and in the inner ear, cochlear, or auditory. Profound hearing loss. A person with a profound hearing loss will not hear any speech and only very loud sounds. 2. Tinnitus or ringing in the ears. Tinnitus fills your ears with sound. This sound no one else hears. It's a common problem. Tinnitus can be severe, affecting people's daily lives. Tinnitus is not a disease. Do you want to know about this tinnitus? Yes, it is a symptom that something is wrong in the auditory system, which includes the ear, the auditory nerve that connects the inner ear to the brain, and the parts of the brain that process sound. If you have tinnitus, your head is filled with sound like ringing, roaring, buzzing, whistling, hissing, humming, grinding, clicking. Some people may hear sounds similar to music or singing, and others hear noises that beat in time with their pulse that no one else hears. It may come and go, or might be a constant trouble. It might be not notice them, or soft or loud, low-pitched, noisy, or high-pitched, ringing, different kind and level of sound. That sounds might be blocked out sounds coming from external sources. People who have tinnitus may have trouble affects the hearing capacity, a feeling of pressure in the ear, loss of balance, headaches, nausea, vomiting, and sweating caused by severe vertigo, a spinning sensation, trouble in sleeping, concentrating. Living with tinnitus can make people feel angry, frustrated, and depressed. What causes tinnitus? It is a symptom that something is wrong in the auditory system, which includes the ear, the auditory nerve that connects the inner ear to the brain, and the parts of the brain that process sound. Tinnitus can develop gradually over time or occur suddenly. Tinnitus is often accompanying with age-related hearing loss, inner ear damage caused by repeated exposure to loud noises, earwax buildup in the ear canal, some middle ear infection, family history of the disease, Meniere's disease, a condition that also causes ear disorder affects your hearing capacity, a feeling of pressure in the ear, loss of balance, headaches, nausea, vomiting, and sweating caused by severe vertigo, a spinning sensation. In general, there are two types of tinnitus: subjective tinnitus, head or ear noises that are observable only to the specific patient. Subjective tinnitus is usually traceable to auditory and neurological reactions to hearing loss. More than 99% of all reported tinnitus cases are of the subjective variety. Objective tinnitus, head or ear noises that are audible to other people, as well as the patient. Objective tinnitus is very rare, representing less than 1% of total tinnitus cases. Treatment course: tinnitus will reduce from 6 to 9 months of period of treatment and completely stopped within 12 months. Results may be vary patient to patient. 3. Ear infection, pus discharge. Major symptoms of ear infection include ear pain, fullness in the ear, hearing loss, ringing in the ear, discharge from the ear, sickness, vomiting, and giddiness. Causes ear infection, pus discharge. A ruptured eardrum can cause a white, slightly bloody, or yellow discharge from the ear. Dry crusted material on a pillow is often a sign of a ruptured eardrum. The eardrum may also damage. Causes of a ruptured eardrum include foreign object in the ear canal, injury from a blow to the head, foreign object, very loud noises, or sudden pressure changes, such as in airplanes, swimming, inserting cotton-tipped wipe or other small objects into the ear, middle ear infection due to high cold or high heat of the body. Seek emergency care for any of the following symptoms: pain in an ear with or without fever, itching of the ear or ear canal, loss of hearing or difficulty hearing in one or both ears, pus discharge from an ear, especially if it's thick, yellow, bloody, foul-smelling, or watery. Treatment course: pus discharge will reduce from 6 to 9 months of period of treatment and completely stopped within 12 months. Result may be vary patient to patient. Our treatment process: we treat hearing loss, tinnitus and pus discharge through traditional SIDDHA system of medicine. There is no known side effects caused from this medicine. First, the patient will be examined thoroughly. This is to diagnose the exact condition of the patient, and afterward we will inform to the patient whether the disease is treatable or not. This medicine is prepared from rare herbs on the basis of traditional Siddha medicine method. We are practicing Siddha medicines along with Varma sastra for treating our patients. We pour the medicine in the form of ear drops. After pouring the medicine, the ear and pinna are manipulated at specific pressure points to stimulate the nerves, and thus this helps in improving the conduction through ossicles of ear. Immediately, the ear will be cleaned with cotton buds. The patients are counseled to get a better idea about the ear problem and the treatment procedure. At the time of treatment, practice and exercise to the patients for improving hearing conditions and to regain their pleasant mind are advised. Those who patient are below 60 decibels hearing loss. They can able to answer even when asked a question from a long distance, and they can hear mild voices, even whisper, and also, this takes maximum 2 hours, but 3 hours is mentioned as total time because it may vary from case to case. After that, a lecture will be given about the practical ways to be followed by hearing impaired patient for an hour. The treatment course is purely dependent upon the severity of problem the patient have. Patient those who have more than 60 decibels hearing loss, they can get the hearing power by our treatment course of time. According to their hearing loss, treatment course may change. We advise the treatment course to the patient for a period of minimum 6 months and maximum according to the patient condition, depending on his problem. A specially made exercise card is given to the patient to follow regularly. This is for improving and maintaining the hearing capacity. A diet card is also given to give an idea about the food to be avoided. The patient is strongly recommended for completing the full course treatment for the best results. Patients who are not having their eardrums can also able to hear after getting the treatment. The entire treatment is done visibly and with no absolute secrecy. All results are observable to all who comes daily to our clinic for treatment. Age limit, 1 year to 90 years. Treatment course, according to the patient condition. Hearing loss at birth. It is a well-known fact that initial years of a child are important for the overall development of a child. Mother plays a vital role in it. She does not teach a child a language, but also makes it convenient for learning. A child copies the same words which her mother speaks. Unfortunately, this principle does not apply to a hearing loss child. When a child is not able to listen a word, that child finds difficulty in searching her language. A child who does not have hearing loss in her early years tries to convert her voice of a noise to sound and that of a sound to a voice and voice to a language. But a deaf child is unable to hearing a sound and that child is not able to develop their voice, and this causes dumbness. The worth of parents should try to recognize at an initial level of deafness for their children. Treatment method for inborn deaf. Age limit, 1 to 24 years. We even give treatment for patients using hearing aid and those underwent cochlear implantations. Treatment course, 2 years, 3, 5 years. Method and usage of medicine, external medicine for ears and head. Avoid the loud sound and save the ears. Thank you.